Vision impairment. It may sound obvious, but people who have impaired vision have a high risk of falls. When was the last time you had an eye exam? When was the last time you had your prescription adjusted? Have you been tested for the early signs of cataracts? Is the lighting in your home suitable? Can you see the stairs? Are you able to visually see any trip hazards in your home? Adapting for visual impairment, having it monitored and adjusting the lighting in your home is a good measure to reduce your risk of falls at home, which is the #1 place where falls occur. Chronic conditions such as arthritis impairs our ability to move efficiently and often is accompanied with weakness around those joints. Osteopathy, physiotherapy, they're all very skilled at dealing with these problems and helping improve the function of arthritic joint, particularly when you incorporate specific strengthening exercises that build the strength and flexibility of those joints. All these different forms of physical therapy are highly effective at improving the quality of life for arthritis sufferers. Diabetes. Is your diabetes controlled effectively? Is your medication reviewed? Have you had the nerves in your feet tested for any sort of sensory or peripheral neuropathy which affects the ability to get feedback from the toes and the feet? If you can't feel your feet effectively, then you are going to bend over and look at the ground to compensate for that. So effective diabetes management should be a high priority. People with Parkinson's and those that have had a stroke have their ability to move and have good balance significantly impaired. But the good news is there's so much out there which can be done to help Parkinson's sufferers, people who had stroke, and people that suffer with other neurological conditions. So when considering chronic conditions, you can see people that have experience in that type of corrective exercise, and they can create a safe environment. You can exercise safely. They give you sensible exercises which challenge you. So please, if you have any of those conditions, see a suitable expert near you. Medication side effects. Certain medications, particularly psychoactive medications, are prone to creating dizziness. Others can interact in a way which lowers your blood pressure or causes dehydration. And this situation is more likely to occur with the more medication you're on. And those on 5 or more medications are at highest risk. I recommend people have the medication reviewed, even if they don't have symptoms, but have some form of regular reviews once a year or once every 6 months ideally. If you feel that your medication could be potentially making you dizzy or unstable on your feet, discuss this with your doctor, discuss the dosages, discuss the prescriptions. There may be alternatives that their GP can advise or change your prescription in some way which gives you the benefit of the medication without these side effects. Falls are a serious risk factor for premature death. 684,000 people worldwide die from accidental falls, severe brain trauma, hip fractures, life-changing injuries. So therefore, if your medication giving you symptoms which may put you at risk, do consult your doctor and discuss it with them. Low blood pressure is a significant risk of falls. In our clinic, we routinely screen everyone's blood pressure, and sometimes we see people that were on blood pressure medication because they was in a very high group. The medication did bring them back to the normal range, but unfortunately, because the medication hadn't been reviewed, the medication actually pushed them beyond the normal range into the low range. If your medication is taking you past the healthy range into the low range, you need to discuss it with your doctor and find out the benefits of being in a low range, and you can balance those out against the risk of falls. Low blood pressure or hypotension. Hypo means low, hyper means high. Hypotension poses a significant risk factor for falls, especially among the older population. And the connection between low blood pressure and the increased risk of falls has been substantiated through various research studies and analysis. It is well researched. We know that low blood pressure increases your risk of falls. But sometimes your blood pressure is normal until you stand up quickly, and we call that orthostatic hypotension. And this is where the two figures, the top figure is the systolic and the bottom figure is the diastolic. The top one can drop by 20 and the bottom one by 10 just by standing up, and some people that triggers them to go into the low blood pressure range, the hypotension, and that sudden drop means they could pass out, fracture hip or hit the head, and in some cases it can be way more serious than that. But it doesn't have to be a second you stand, it could be within the first 3 minutes. Postural hypotension and orthostatic hypotension, a drop in the blood pressure with standing and movement. There's several factors which contribute to the risk of hypotension related falls. These include dehydration, prolonged bed rest, certain medications, particularly antihypertensives and diuretics, underlying conditions such as diabetes and Parkinson's disease. So the management strategies for fall risk associated with low blood pressure include your medication review, adjusting and changing medications to reduce your risk of low blood pressure, hydration, drink lots of fluid, not tea, not coffee, don't listen to the myths, drink lots and lots of water to stay hydrated to maintain your blood volume, change your positions more gradually so you don't suddenly get up really quickly. It can be from people drying their hair and flicking their head back or just getting up really quick. For many, particularly in this part of the world where we get very little sunshine, many are vitamin D deficient, and studies have shown that vitamin D supplementation from those that are deficient reduces their risks of falls. So taking a few good quality supplements is probably sensible. Do you have a balanced diet? Do you have healthy proteins? Do you eat at an interval which gives you nice, stable blood sugars? Are you having to snack all the time? Because that's not ideal. It's important to plan and prepare and have good food in your house. Plan your meals. Unfortunately, we often see with older clients, particularly if they are living by themselves, they don't tend to put as much effort into their eating anymore. They'll just eat whatever's going, or they'll go long extended periods of time without eating. This is not sensible. Start with the principle of 3 meals a day, incorporating plenty of good quality vegetables, good quality protein, healthy fats. 3 meals a day is a really good starting point for most people, and give variety of food so you don't get nutrient deficient by eating the same food every day. Give a good variety. And when you eat like this, you tend to have much better energy, much more stable blood sugars, and you're less likely to have these dips in blood pressure. Fear of falling syndrome. Fear of falling syndrome, either a rational, genuine concern for your risk of falling, or an irrational over fear, and this becomes a self-fulfilling prophecy. Horrible, vicious cycle, because as you get less confident and you're more fearful, you're less likely to go out and be socially engaged. You're less likely to move around your own home. Less you move around your home, the more unstable you become on your feet, and you have to actually just hop sort of from furniture to furniture, furniture surf as we call it. As we said earlier with the sarcopenia, if you don't use it or you lose it, the muscles will just atrophy over time, so your joints become less stable. So this fear of falling syndrome really does perpetuate and make things worse, and just isolates and means at some point you probably are going to have a fall. Once you've taken the irrational fear out of the equation, then you can work on the genuine risk factors, your risk factors to falls, whether it's your strength, your frailty, your balance, posture, ankle mobility, flexibility. Speak to someone to get the irrational fear out of the way, and then work with someone to work on the genuine risk and start improving as of today. So let's look at environmental hazards and your home checklist. What you can do to make the environment around you safer, whether it's for you individually or for a family member or a loved one, and you can go through it methodically, making changes, reducing the risk factor in and around your external environment. Home safety modifications. Living areas. Remove clutter. Keep floors clear of cords, loose rugs and clutter that can cause you to trip. Secure rugs. Use double-sided tape and hold it down. Don't have any loose flapping around bits. Secure your rugs to the ground. Improve the lighting. Ensure the living area is well lit. You can put lights on timers. You can use remotes for lamps if the light switch is in an awkward place. You can do voice-activated lights, and ensure the living area is well lit. Arrange furniture. Some people's furniture is laid out in a very strange way. Clear it out the way. Make sure the furniture is sensibly laid out. Bathroom safety. Make sure there's no trip hazards or clutter. Grab rails can be helpful if needed in the bathroom or the shower area. If you are unable to comfortably get to 90-degree squats, you can have a raised toilet seat. A shower chair can be very helpful. And non-slip bath mats. Kitchen safety. Accessible storage. Keep frequently used items in your kitchen in the lower cabinets to reduce the need for climbing up or reaching out and having to bend over to the back of the cupboard. Ensure the floor is slip resistant, or you have slip resistant mats in the kitchen. Stair safety. Have handrails on both sides which are securely fastened. Step visibility. Is there adequate lighting? Is there light switches at the top and the bottom of the stairs? Or is the contrast as such that you can't quite see the steps? You might have to make adjustments and use high contrasting materials. Personal safety measures. Proper footwear. Don't be wearing flip-flops, slippers or high heels. Avoid walking in socks and slippers or anything which doesn't have grip. Your footwear should have a nice grip, should fit nice and snugly. I see a lot of people, because they can't put their shoes on and off so well, they just sit and squash down the back. This is just an accident waiting to happen. If you have things like ankle edema, often you're wearing the wrong shoe size and you wear these open toe sandals which don't really help, or we walk in our slippers. So high heels, slippery soles, poorly fitting footwear is really a no-no if you want to reduce your risk. But you want your shoe to support your foot and protect you from falls. Many of our patients who have balance or walking issues and gait issues, then they'll often need to use mobility aids in the early days at least. However, a lot of people we see who have a cane or some sort of walking stick or a walker, they don't use them correctly and they put all the body weight on it, and actually they're really increasing their risk of falls. So although mobility aids can be very helpful, they're often used in a way which puts them at a higher risk, not lesser risk. Sometimes people are very resistant though to use mobility aids, and I always say if mobility aids are giving you independence and not taking it away, it's right for you. Coming to the fear of falling syndrome, some people become so over reliant on those that they actually get less and less able, less balance, less strength, less mobility, and over reliance on the mobility aids where they actually make it worse and it takes your independence away. Sensible mobility aids such as walkers, canes, and being taught how to use it, and handrails around the house, they can give you independence and able to do more and gain some of that freedom back. If you don't know how to use them, see someone in the area who will show you how to use a cane properly, use walkers, set them up properly, make sure everything's the right height, and show you how to use them, give you that independence back and gives you more ability to be active in your community. Physical activity. It's important to be active. It's that use it or lose it. It's the sarcopenia. You don't want age-related muscle deterioration, muscle loss. You need to be active, so you need to walk regularly. We have people that can't leave the house because they can't walk far enough, but we might get them to do little loops of the room, walk to the sofa and back, and we build up that activity based on their individual needs. Do strength training. See someone who knows how to actually strengthen these muscles. Do a little balancing exercise at home. Stand on one foot with support and gradually build up. Be active, engage in regular physical activity. Do flexibility work, do things such as Tai Chi, yoga, Qigong, do balancing exercise, do some strength work, get up and down out of that chair nice and regularly like we said. Be active, make your body strong, supple and nice and upright as humanly possible. Health management, medication reviews. In my view, medication reviewed every 6 months, but at least every 12 months. Sit down with your doctor, discuss your medication. If you are getting side effects, then discuss that with them and they can make adjustments as needed. Vision checks, have regular eye exams, have your glasses, prescriptions adjusted. Stay hydrated, do not let yourself get dehydrated and do not buy into this myth that teas and coffees count. Drink water, that's what the body is designed to do, and drink plenty of it. Eat a balanced diet, incorporating good quality proteins, good quality fats, and nice non-starchy vegetables and salads. Plan your foods, plan your shopping, plan what you're going to eat. Make sure you've got probably the 3 meals a day as a good starting point. This will help regulate your blood pressure, control your blood sugars, and give you good energy and vitality. Stay socially active, engage with your friends, your family, your community and social groups. We are social creatures. We are meant to have relationships with our friends, our family and our wider community. And when we strip that back and we become isolated in our own home, our mental health is going to rapidly decline. So it's really important as a human being is to actually engage with the wider community. Fall prevention education. There is such a wealth of information at our fingertips. So whether you're watching this video here or you're working with practitioners in your area, there's so much you can do and apply it into your lifestyle. Please share this information and pass it on with them. With the home safety checkups, look at it periodically. Has your house been nicely tied and decluttered and all of a sudden the clutter's back? Every so often go through this checklist and reevaluate. If you need more support, come and see us, come and see someone in your area. I keep saying it, but see someone who knows how to help you. There are so many one-to-one and community-based fall prevention programs. There's a lot which can be done to help you, so get the advice from an expert. To download a free copy of the fall prevention home checklist, visit clarkshealthcare.com/falls. That's clarkshealthcare.com/FALLS. You can download your free copy. That covers all the main areas we're going to go through today. Falls are not an inevitable part of life, and that's really good news. Now, it can sound quite heavy when I'm talking about 684,000 deaths, 95% of all hip fractures, we're talking about serious head traumas and life-changing injuries. It can sound very scary, but reality is, each of the action points I discussed is backed by my own clinical experience and extensive clinical research, and they're all shown to be able to reduce your risk of falls. So sensibly go through each of the action points I discussed and see if you're able to make improvements on that. We're looking to give people more independence back so they are more engaged with their community. They can get out and do daily life and feel socially engaged with the people around you that you love and care for. If you're doing it at home, have support around you, set up your environment and do it in an incredibly safe way that you're not going to harm yourself. But start low and build slow and make improvements. Write it down, look what you're able to do and build it up. Every week make improvement. Or better still, you see someone in a fall prevention program near you. That will take things to a whole nother level. And in 12 months, you won't be the same person anymore. Thank you for listening. I wish you the very, very best of luck and I wish you good health. Bye for now.